make your life easier. Moms Every Day.
Welcome back, everyone, to Moms Every Day. I am joined by Dr. Rittinger. He's the Director of Hospital Medicine at OVP Health. Thank you so much for being here, Dr.
I appreciate you having me.
Well, what are your responsibilities, with OVP Health as Director of Hospital Medicine?
So at OVP Health, we offer a variety of patient care services. We have the outpatient service line for general medicine, our MAT services, and our recently opened recovery center. But we also provide our partner hospitals with emergency medicine as well as hospital medicine programs. So as Director of Hospital Medicine, or hospitalists, my primary responsibility is in the implementation and oversight of those hospital medicine programs. We work with our on-site physician leaders as well as the hospital leadership to develop processes to improve the delivery and quality of patient care, as well as just improve the patient experience during their stay.
I know that's so important right now, especially with the pandemic ongoing. Sure. Let's talk about it. COVID-19, have you seen it make a pretty significant impact on hospital care in our region?
Oh, absolutely. And not only in our region, but nationwide. One things we were challenged as hospitalists with our partner hospital was just generating protocols and procedures for taking care of those patients, as well as taking care of the patients that don't have COVID during this time. One significant impact I think we've seen in the hospitalist world nationwide is that during these times our hospitals have had challenges where they've had to restrict visitation during those hospitalizations, and that this is a very difficult time for families just to have their loved ones hospitalized. And we've worked with our hospitals to make sure there's technology in place that we can communicate with those communicate with those families during that time. And as well, there's been a significant impact to our providers themselves. They're tired, they're mentally and physically tired, and I can't say enough how they have stepped up and put the patients first and themselves and their families second throughout this time, and made sure that those patients were taken care of. And I cannot say enough how proud we are from OVP of all of our providers.
You have to be proud of them. Our first responders, our people on the front line have just really stepped up and taken care. And it has been, like you said, a really tough time, because it's hard enough when someone that you love is in the hospital, but not being able to be there with them can be even more difficult. And on a different side of the COVID-19, let's talk about the rollout of the vaccination. It's been a bit rocky nationwide. I know West Virginia's gotten a little bit of love in terms of it rolling out pretty smooth here. How would you say that the tri-state region is doing, and what needs to be done to improve things? I'm sure it can always go a step further.
Sure, and it has been a very frustrating time with the vaccination process for many, and I think if we do look at West Virginia and we look at our local health departments, they have done a tremendous job with really the cards they've been dealt. And if you look at the limiting factor really isn't the process. The limiting factor is just the amount of vaccine. So all of those long waits on phone calls trying to schedule appointments, all of those phone calls get answered when the appropriate amount of vaccine is available. So in medicine we always look back, we always will analyze and see what we can do better, but right now the limiting factor really is the amount of vaccine.
So we're just waiting to get more vaccines to get them to more people.
So as those get rolled out, I have personally participated and volunteered in one of the clinics in Putnam County, and Dr. Roby, who runs that, it was incredibly efficient. The patients had a great experience. It's just really a matter now of getting more vaccine into those hands.
So people just be patient.
That's correct.
It's going to get there
patient.
eventually.
It is coming.
Well, I know that we're hearing about some unpleasant side effects from the vaccine, especially after you get the second dose. Is that correct? And are those side effects, serious enough that they should really, prevent anyone from wanting to get the vaccine?
Yeah. So side effects in general are expected, and everyone going into the vaccine should know that there's common side effects to include headaches, body aches, some fever, and some injection site soreness. Now, the injection site soreness is the most common, but we have seen in just very recent data that about 1 in 4 patients after the first vaccine will have additional side effects to the injection site, but when you get to that second vaccine, it actually doubles to about 50%. But those are self-limited. Those are not, by far, should not deter anyone from starting or completing that vaccination process.
Right. And if you've already had COVID-19, should that person still go ahead and get the vaccine anyway?
That's a great question. So having COVID-19 does not prevent you from getting the vaccine in the future, but there are some factors that determine when you should get the vaccine. So for instance, a patient who had COVID-19 but during their treatment had to go through what's called passive antibody therapy. That would be like monoclonal antibodies or or convalescent plasma. Those patients should definitely defer their vaccination for a minimum of 90 days.
Okay.
Now, everyone else who's had COVID-19 who has completed that recovery as well as isolation process, they are eligible for the vaccine. But what we know is that they have a level of immunity present, and recent data has shown us that that level of immunity stays stable for about 6 months. So they may want to defer their vaccines so that other high-risk populations without immunity can go ahead forward with the vaccine. Now, the third question that's been really common recently is, well, what happens if I get COVID-19 in between my first vaccination and my second vaccination? And the current recommendations are, once those patients complete their isolation process as well as they clinically recover, they can proceed forward with the vaccine process as scheduled or schedule that in the future.
Okay. And great questions. I know we're getting so many of these questions or great answers, I should say. We're getting a lot of these questions into our newsroom. So thank you. Very enlightening.
No problem.
Thank you, doctor, for being here today. And thank you all for joining us for Moms Every Day.